so I've checked my provider's orders, and I'm going to go into John Smith's room to change his central venous access dressing because it's been 7 days and he's due for a new dressing. I've got all my supplies, and I'm just checking my solutions to make sure that there's no precipitants and that they're not expired. They both look good, so we're ready to go in. Perform hand hygiene, provide privacy. Hi John, my name's Autumn, and I'm going to be your student nurse today. I'm going to clean off my surface and set down my supplies. So we're going to be doing a central venous access dressing change today. Every 7 days we should do it just to make sure that there's a decreased risk of infection. And I raised your bed up so I can reach you better. Can you give me your name, date of birth, any allergies? Okay, perfect. So I'm just going to look at this site here. It looks like there's no redness, there's no skin breakdown, and has there been any pain there? Okay, great. So I'm going to perform hand hygiene again. And I'm just going to remove this dressing, okay? I'm going to put a mask on you, and then while I'm removing it, I'll have you turn your head away just so that we don't have any droplets or any breathing on the site, so that it has the least chance of getting infected, okay? Awesome. All right, and I've got my mask on already. Here's your mask for you. All right, and go ahead and turn your head the opposite direction. I'm going to go ahead and take off this dressing, okay? And I'm just making sure that I'm holding down the catheter so that it stays in place. And I want to be removing away from the catheter itself so it doesn't become dislodged. All right. And again, I'm just looking at that to make sure that there's no redness, no skin breakdown. And if also there was a lock, a safety device, I would remove that as well when I remove the tegaderm. All right, and it looks good, so just go ahead and keep your head turned that way. I'm going to set up my sterile supplies and get you a new dressing, okay? Perform hand hygiene. Both of my hands are in the sterile glove. I'm just going to position them how I need, just because some of the fingers didn't get in the right spot. Okay. And those are positioned good. Go ahead and take my ChlorPrep, click that, clean up on the catheter, clean back and forth, 15 to 30 seconds, making sure I'm moving in to outward, cleaning the whole area. All right, I'm going to discard of that, make sure that that dries properly, and if I had a new safety device, I would put that on. Also going to put some skin prep on so that there's no skin breakdown once we put the tegaderm back on. So that's dried properly now. All right. And I'm just pressing this down to make sure that there's no air bubbles and as many the wrinkles that I can get out. Okay, and then I'm also going to put my initials, the time, and then the date that I put that tegaderm on so that we know when to change it next. And now that my hands are just clean, I'm going to go ahead and do some maintenance on one of the lines for you, okay? So I'm going to set up that supplies real quick. And my saline. I'll just make sure that this is prepped and there's no air bubbles. Also going to make sure that the safety lock, or the saline lock, is also primed. Loosen my cap on my heparin. Prime that as well. Alright, and I would do this on all the lines, but I'm just going to demonstrate on the one line. So I would look at it, make sure that it's clamped, and it looks like it is clamped. So I'll go ahead and clean on the hub. 15 seconds. Alright, get my saline ready. Okay, and I'll go ahead and have you bear down. I'll remove the saline lock that's already on it. And I'm going to go ahead and clean this as well. Make sure that that dries. Connect my saline. I'll unclamp the line. And I'm going to aspirate. And I see a blood return, so that's good. I'll go ahead and push pause. 5 milliliters of the saline, just to clear the line. Okay. Clamp the line and remove my saline. This goes in the trash. I'm going to remove the top of my heparin, and I'm going to clean this port once more. All right. Connect my heparin. Perfect. Unclamp the line and push pause. 3 milliliters. All right, I'll go ahead and clamp the line once more and remove my heparin. That goes in the trash as well. Take all of my supplies, discard them in the correct reciprocals, remove my gloves, and perform hand hygiene. All right, and how does that feel, John? Good? Okay, so I'll put your bed in the lowest position and take your mask off for you. All right, and here's your call light. If you have any shortness of breath, any chest pain, any pain in the site, or anything that you need, just give me a call. Right now I'm going to be over here documenting, so I'll go ahead and make sure you have the call light, bed in the lowest position, hand hygiene, and document.